supine hip axial. An axial is any movement where we just rotate the joint. So when you guys did your assessments for the hip, we did a supine hip axial to test how your hip rotates. We laid on your back right here, we brought your knee up, we rotated it inward as far as you could, and then we rotated out as far as you could as well. That is essentially what a supine hip axial is. Same exact concept. 90 degrees at the knee, right here. Knee stays above the hip the entire time, meaning I don't let it come up and out as I rotate in here. I minimize compensations. So I go over as far as I can, and then I slowly go out as far as possible as well. Making sure that this is the only thing that's moving. I'm not hiking the hip up either, that no part of my body is compensating. I'm just working on whatever rotation I have, no matter how minimal it is. And this is the key. If right now you don't have a lot of range, that's fine. You just have to train what you have. So usually we'll do this after, or sometimes either after or before you do your pails and rails. Whichever way you do it, it is training the range we either just opened up with our pails and rails, or it's a way to prep the tissue for some sort of lower body movement to train what you already have. So make sure you're treating this as if, okay, I'm going to go as hard as I can into my end range to make sure that my body's prepared for that position, or I've just opened up some range from my pails and rails, so therefore I need to train as hard as possible in the range we've opened up. Can't emphasize that enough. We're not going into pain, but it should be pretty uncomfortable, especially when you go out into internal rotation. When the foot goes out to the side, expect some cramping.